is Miriam Behar. I'm a MD, I'm an associate professor of pediatrics at UK. I do primary care pediatrics. I'm in the Division of General Pediatrics, and we basically provide a medical home for children from birth, arbitrarily up until the age of 18, although that's not a hard and fast rule. Most of the work that we do is preventative, so we're in my specialty. I take care of mostly healthy children. You know, if they're sick, I can usually treat most things, but obviously if they have a really specialized problem, I have to send them on to a specialist. But really my focus, I think, is partnering with parents and caretakers to raise healthy children and help them to make appropriate choices, regarding all kinds of things, in terms of nutrition and exercise and following development and growth. So I see myself, I guess, primarily as an educator, and really trying to help parents make good choices as they're raising their kids. My first job was in Stillwater, Oklahoma, which is really quite isolated, and if I had a child with anything significant, I would have to ship them to either Tulsa or Oklahoma City. So having local expertise is amazing, and people are basically a phone call or an email or a text away. So even just in terms of getting advice on how to handle a more complex problem, I have the expertise right here. The coolest part of doing primary care is the continuity. Ideally, you get a child as soon as they're born, and then you stay in a place long enough that you watch them grow up. You become kind of a member of the family. You're the person that the caretakers trust, to give them guidance about, what's the best thing to do for their child when they're healthy, when they're sick. And then as the kids grow older, you develop your own individual connection with the kids as they become sentient and can really communicate with you on their own. It's not just the time that you spend in the office with the patient, it's all the front work and the back work that you have to do also to make sure that you're making the right referrals and getting the right information that you need. I feel like I'm very thorough, and I advocate for my patients as strongly as I can, which often involves, following up in the evening, following up on weekends. I will not rest basically until I feel like I've explored, every possibility and tried to, get that patient and that family to the best possible care.